I'm Linda Healy. I'm a nurse practitioner, and I am the director of both palliative care and of geriatric services. The latter is taking care of the medical needs of the residents in Mary Pickford House in Harry's Haven here on the Wasserman campus. Most people think about palliative care as the same thing as hospice. And the way I like to explain it is that palliative care focuses on comfort, quality of life, symptom management when someone is dealing with a serious diagnosis. It's appropriate at any stage of an illness, any prognosis. It's just the things that, the major illnesses that can derail a person's life, not so much pneumonias, but cancers, heart disease, liver disease, things like that can really, a person's having to live with and struggle with. And that's what palliative care, where it comes in. So we see most of our patients on palliative care in the outpatient clinic setting. And that's because most of our clients live out in the community. They're either still working in the industry or they're industry retirees, but they don't live here on campus. Mm-hmm. We have some that do. For the majority of our people, about 70% of them, they're living out in the community. So the challenge for us through all of this and social distancing has been, how do we maintain that physical human contact with people when it's really not safe for them to come into the clinic? It's better, they're safer in their homes, but then we don't want people to be, again, the whole point of palliative care is you're not alone as you deal with this. So if you're sitting in your home, how do you not feel alone? So that's where we've been working very closely with our IT department, and all of us on the team have gotten much better at using Zoom technology and other forms of technology to be able to stay in touch. A typical palliative care appointment, when a person comes into the clinic, they spend 30 minutes with the chaplain and the social worker and 30 to 60 minutes with the physician. And the reason that they see all three is that, again, when a major illness impacts somebody's life, it's not just the physical symptoms that keep them awake at night. Mm-hmm. It may be worry about, I'm out of work right now, and how am I going to pay my bills, and who's taking care of my family, and I'm worried about this family member, or it may be those questions of why me and why now that keep them up at night. And so that's why we use chaplaincy, social services, physician or nurse practitioner to really wrap the person around with a team of experts that really, we've all certified and trained in this field. So they're really getting people who know how to help them and support them best. So translating that to the new norm, which is all of us staying apart from each other, we're using video visits as much as we can, so that in real time, face to face on a screen, the patient has a visit with their chaplain and their social worker. If someone really doesn't have the technology in their home to be able to do that, then of course we'll use the telephone. But there's so much that can be said through body language, or those silent moments they're more therapeutic and acceptable if you can actually see the person's face, as opposed to sitting on the phone wondering, did they hang up? Are they hearing me? Mm-hmm. So we're using a lot of video. Our palliative care coordinator has become a real expert at talking people through, this is how you set it up, this is how you install this is what you do. So she's become a real IT whiz herself, just to get our patients up to speed to be able to use this platform. And so they'll have their visit with the chaplain and the social worker, and then either the same day or more commonly the next day, it's a scheduled appointment again with the physician or the nurse practitioner, commonly the physician, that they'll talk video to video and really be able to address some of the symptoms they may be having, or some of the physical concerns. Prescriptions can get phoned in or filled, online, so that we're really, and then things can be delivered from pharmacies. So we're trying to keep people safe in their home, but not feel like they're just sitting there without a team still supporting them. So that's really what we've been doing a lot of phone calls with. And when people don't have a scheduled appointment, our coordinator, our social worker, our chaplain, each one is reaching out and just checking in with people. How's it going this week? And just making sure that they know that we're here, we're thinking of them, and we're ready to continue to support them as they continue to live with whatever the condition is that they're having to live with. The delivery of care on campus, again, social worker, nurse practitioner, RN, chaplaincy, typically for a palliative care person being served in Mary Pickford House or Harry's Haven. And we are doing part of that now virtually, where our chaplain has FaceTimed with some of our patients and been able to have really in-depth, 30, 40-minute conversations in depth in that way. I'm at myself and the RN, we're here live. And so we're suited up, masked up and everything to protect our residents, and are going in and actually able to continue to able to see from the nose, from the eyes up, that is face, and that we can still be there to care for them and manage their symptom needs. And then our social worker is also working virtually and making supportive phone calls not only to the resident but to the families, because families are worried, understandably. And right now here on campus, they're separated from their loved one. So we really want to make sure that we maximize the attention to them and help them have their needs. Our activity staff is making sure that the families and the resident are connected through FaceTime. So we're using a lot of technology to get people to actually be able to see each other's faces and smiles and be able to visit. And that's the big thing. I always like to say palliative care is not so much about, we definitely want people to be able to survive and be able to wake up that next morning. But the big thing is there's got to be a reason to. Mm-hmm. And so about those moments in life and those pockets of joy throughout the day, that's what we're trying to focus on. We're all going through so much stress right now. I'm constantly talking to families on the phone about, look, we're taking care of your loved one. They're here under our umbrella and we're really taking care of them. But for yourself, you got to go through the basics. You've got to get enough of the right food. You've got to make sure you try to get some rest and get some fresh air and get a little bit of exercise and things like that, because when we get really stressed, many times we kind of start ignoring those needs. This is the time that's most important for people to tap into whatever it is that gives them a sense of strength, but also paying attention to what their body physically needs. You may not feel hungry because you're really stressed out, but you haven't eaten for the last 8 hours. So it's like, try to eat something. So it starts into those things that we all know we're supposed to do, but when we're really stressed or feeling really, uptight or scared or anything, it's sometimes harder to tend to those needs, but those are the things that are going to keep us healthiest. They're going to keep our immune systems up more. So I'm really trying to also, I guess because I'm coming from the nurse practitioner point of view, keep your body healthy. I know it sounds cliches, but we really are all in this together. And just like MPTF has been there for the entertainment industry for now almost just that close to 100 years, we're still here for you. And so in whatever way you need us, just know we're here. And we haven't shut down because of this virus. And, we're still got all of our social workers and all of our staff and all of the nurses and everybody. And so we're here if you need us, and let us know. And just know that here on campus, we deeply appreciate all the love and support and good wishes that we're getting from the industry community as we deal with this virus that's in our midst.